even while you are attempting to try to get pregnant, stop alcohol, stop cigarettes, limit your caffeine. If you can do no caffeine, especially if you have a history of recurrent miscarriages, that would be excellent, because caffeine can alter your hormones, and it can also stop ovulation. You want to try to remove any environmental toxins, meaning BPA, that are found in plastics, canned foods, hair products. You want to make sure that you are dealing with receipts that you get from the ATM or that you get from the supermarket very cautiously, because they carry a very high amount of BPA inside of receipts. And what that does, it goes directly into your bloodstream through your fingertips. And those act as endocrine disruptors, and they mimic estrogen in the body, which creates huge hormonal imbalances. Even things like candles, shampoo, hair products, makeup, all of those things are endocrine disruptors, which increase the estrogen in our body. And estrogen, what it does is it makes everything grow, especially in Black women. It's like a fertilizer. It makes everything grow. And when your estrogen levels are way too high, it decreases your progesterone levels, and it creates estrogen dominance. And this can definitely cause miscarriages, early term miscarriages. So those are some things that you can try to avoid and work on eliminating. These are the basic things.
The best way to prevent a miscarriage from happening is actually by identifying the cause. Basically, you might not be able to identify the cause of your miscarriage yourself, so you'll be needing the help of your healthcare provider. Your healthcare provider is going to send you for some series of tests and some checks to find out the reason you've been miscarrying. And this they do mostly for people who have what we refer to as recurring miscarriages. They might send you for some checks to look at your cervix through ultrasound, or do some hormonal tests for you to check if you're producing the hormones that help keep pregnancy, like progesterone. Let's say, for example, the reason for your recurrent miscarriage is because you have a shortened cervix, or what we refer to as an incompetent cervix. Your healthcare provider might offer to do a procedure for you after your first 12 weeks of pregnancy, which we refer to as cervical cerclage. So this will help keep the pregnancy till term. Let's say you're not producing enough progesterone, which is a very important hormone needed in pregnancy at the early stages. Then your healthcare provider might actually offer you a medical replacement for progesterone, and you'll be able to carry your pregnancy till term. So just note that the basic way to prevent a miscarriage from happening is to identify the cause or the reason you might have had miscarriages in time past. Another way you can actually prevent having a miscarriage is for you not to take alcohol when you're pregnant, do not smoke when you're pregnant, and make sure that any medication you're taking during pregnancy is prescribed to you by your healthcare provider. These are some of the ways that you can prevent miscarriage from happening. It is not all encompassing, because there are other ways that you can prevent miscarriages. This is your celebrity sonographer bringing you tips on pregnancy scans. Join me in my next video.